We're going to head back to Ontario now, where numbers continue to trend in the wrong direction. Today, the province posted its highest number of new COVID-19 cases since early May. And for a fifth straight day, Ontario has fallen well short of its testing goal. Premier Doug Ford says testing will begin to ramp up after a new directive was issued and with some help from the feds. And the CBC's Lisa Shing joins us now from Toronto with the details. Hi, Lisa. Good to see you again.
Hi, Vashi.
So what do we know about what Ontario plans to do?
So we're getting a better sense of that today, Vashi. This, as for the last 5 days, Ontario has been consistently lagging in the number of tests. We've not hit our target of 16,000 tests a day, that goal for quite a while now. And we're well short of the 20,000 day capacity. Today, we're about 11,000 tests in. This as Prime Minister Justin Trudeau put out a plea basically asking provinces to step up the testing, and they're offering federal help as well with not only testing materials but also people power in terms of contact tracing. So in light of all of that, reporters for the last few days have been asking what is the next step of this testing strategy after Ontario has finished testing long-term care homes. That's when we saw the numbers go up slightly. And here's what Premier Doug Ford said today about that.
We're going into the seniors' homes. Testing the seniors, we're testing all the staff there. We're going back into long-term care. We're checking with the staffs and the residents as well. There's one thing to test once, but we have to continue testing. We're going into the frontline healthcare workers, and we're going to test the asymptomatic and symptomatic people there. So it's just ongoing testing. I said we're going to ramp it up. We're going to ramp it up. Then we're going to go into communities where there's, as I say, the hot spots, and it's really the urban centers around Toronto that we've seen.
So we're also hearing, Vashi, that the province will start testing people like truck drivers as well as those in factory settings starting next week.
And remind us, Lisa, this does come after a lot of criticism about the province not having a plan.
It does. A lot of criticism, especially considering our capacity that's close to 20,000 tests a day. So a lot of experts have been asking, if we have that capacity, why exactly aren't we using it to get a better sense of what exactly is going on, especially in the community? So I spoke with an epidemiologist today who told me that testing in the community is just as important right now as targeted testing.
Ideally, in the short term, that's what you would want to be using those tests for, is to really expand that testing and make sure that we're finding all the cases in our community that previously we were missing. And then, we can start talking about, how do we monitor more broadly what's happening in the community.
Now, experts are also suggesting that we should be looking to other provinces in Canada and follow their example. For example, Alberta has started testing any asymptomatic contacts of anyone who tests positive for COVID-19. Saskatchewan has expanded testing as well to include people like workers who are physically returning back to work. So a lot of people say, we need to be stepping it up and following other provinces' examples, Vashi.
Thanks, Lisa. I really appreciate the update.
You're welcome.
Our Prime Minister Justin Trudeau continued to hammer the message today for the need to test, trace, and share data, he says, to save lives.
First, we need to continue scaling up our testing capacity so we can quickly identify new cases and isolate them. Second, we need to accelerate our ability to do contact tracing. Our government has trained federal employees who can make 3,600 contact tracing calls a day, 7 days a week. Statistics Canada has also an additional 1,700 interviewers ready to go who can make up to 20,000 calls a day. Third, we have to ensure that data collected across jurisdictions is shared between provinces and territories. This will help us track the spread of the virus, adapt our response accordingly, and save lives.
Despite all of that, the two provinces hit hardest by COVID-19 are falling short right now on testing and tracing. But Ontario and Quebec are also moving ahead with their reopening plans. How concerned should we be about the push forward without broader testing and information on how the virus continues to spread? Joining us now, medical columnist, family physician, Dr. Peter Lin, also a good friend of the show. Hi, Dr. Lin.
Hi, Vashi.
Good to see you. So let's start on that question of testing, because we solicited questions from our viewers for this segment. I would say about half of them I got were about, should we be nervous about reopening economies, particularly in Ontario and Quebec, given the numbers today?
Yeah, the numbers are sort of hovering, and so they're not going down as we're hoping. They're bouncing up and down. So we're hoping by now we should see lower numbers, in which case when we open up, we expect a few increased cases, so then we have some room and buffer to bump up. So the fact that we're not going down, that is of some concern. And more concerning is we don't know where those patients are coming from. In other words, a lot of times we just hear it's community spread. Well, where in the community? Is it the grocery store? Is it the gas pumps? Is it people going back to work? So we don't have a good sense of where those cases are coming from. And I think that's information that we need to know about. In other words, we as the public, because if all of a sudden we know that it's the gas stations, then we're going to take more care when we're there. If we know it's the grocery store, then we're going to take more care when we're there. So if we have a little bit more information coming out towards us, then we'll be able to have some better idea of how we should change our behavior. Importantly, we don't have any information about whether these people took any precautions. In other words, were these people wearing masks or socially distancing, or they had no masks or anything like that? If we hear that the majority of people had no masks and they weren't distancing and they got the virus, then most of us would say, okay, so we're doing all the right things, so we should be protected. But let's say public health realizes that everybody was masked, they were doing it properly, they weren't wearing the mask underneath their chin, how some people have it down here. But let's say they wore everything and they did everything perfectly, and they still got the virus, then that would tell us that the public health recommendation is not enough. So therefore, getting some of this information coming out to us can make us change what we do. Because if I hear that people that didn't have a mask got sick, then that's a good reason for me to wear a mask. Whereas right now, we just get a number, and that number keeps bouncing up and down. And so we can't change our behavior to become better at avoiding the virus.
Yeah, how concerning is it for you that we really don't know the source of community spread, particularly in Ontario, for example?
Yeah, so if it was all, let's say, in the nursing home, then that's great in the sense that we know where it's happening. So therefore, you can open up the rest of the economy. But until we know where it's happening and you start opening up the economy and now people are bumping into each other, we will now see the cases increase. So our worry is that the number that it's sitting right now is bouncing up and down in the 400 range, and that might be increasing. And so if it increases, then we're going to have to lock things down again, and that puts us backwards. So that's what they saw in the Spanish flu. That's what we've seen in other countries. For example, South Korea just shut down, sort of their nightlife district area. And it's putting people back a few steps because now they're afraid to open up because they had these outbreaks. So if we could figure out where things are happening right now, so as we start to open up, we could put things in place to get rid of those things. So if we know that it's the grocery stores, how do we decrease the risk at the grocery store? If we know that it's at the pharmacy level, then how do we do that? So in other words, we can actually put in better steps.
Okay, I want to get to the questions from our viewers. The first, you mentioned masks. How often should I change my mask? And can a cloth steamer be used to disinfect cloth or surgical masks?
Yeah, so if you're using the disposable mask that I've been using, for example, then I'll just put in a piece of Kleenex inside. I know this is crazy, but I put the Kleenex inside so that you're not getting it wet from the inside. Because the moment it gets wet or soiled, then you have to get rid of it. So if you keep changing that Kleenex in the middle, then if you're just going out for an hour to go grocery shopping, that will be fine. Remember that most of the time on our masks, we don't have the virus, right? Because we're not near people. So therefore, our masks are really stopping us from breathing out our viruses. And then other people are stopping their viruses from coming towards us. So chances are there's not a whole lot of viruses. The recommendation, if you hang it up and let it dry with a bit of sunlight, then that's good enough for it to be sort of decontaminated. If you really want to decontaminate, please don't put it in the microwave, because in those surgical ones, there's a piece of metal on the top, and microwaves on metal, it'll spark and that causes fire. If you have one of the cloth masks, right, the cloth mask, you just have to wash it. So if you toss it in with your normal clothes washing, the detergent will kill off any viruses that are there. And if you just want to hand wash it, if you use soap, the soap will destroy the virus as well, and then hang dry. So for the mask ones, you just need two, right? One that you wash tonight, and then you wear the other one, and this one will dry out, and you can just rotate through there. And the reason why these are important is because in the future, it looks like the recommendation is that maybe we should be using masks going outward, because we might not be able to keep that 6-foot distance. And so therefore, the mask may be very helpful for us as we move forward.
And that leads me to my next viewer question. Should seniors or people with health conditions venture out in public even with a mask, or should they be home?
Yeah, so if they have a lot of medical conditions, then staying at home is the best. But if you're, let's say, going to the park where there's no people, then actually that's reasonable. If you're going to the backyard, because we don't want to keep everybody confined, so we want them to get some exercise. So that's why you're hearing all the health ministers saying, you know what, we can actually go out if there's no chance of you bumping into other people, and you can keep that social distancing. In terms of the mask, if an elderly person has a mask on, we still want to keep that 6 feet distance, because remember, the mask doesn't stop you from breathing in the virus, right? Because the holes are quite holy in those homemade masks. And so therefore, if I breathe in, I will now suck in the virus, I guess, if you want to think of it that way. So therefore, I would still not be going into close places like elevators and things like that with other people. That would still run a small risk for the elderly, very sick people. But if it's directly from their home going outside and let's say into their backyard or around the street, let's get some exercise to make sure that their heart is still doing well and all of the other medical conditions are being looked after.
Okay, I have just 30 seconds left, and this last question is the hardest. What would Dr. Lin, what would you have done differently if you were a public health officer? Name one thing.
That's right. They did everything perfectly, right? You know, Dr. Henry, Dr. Tam did a great job with the information that they had. The only thing that I think we should do is we should always assume the worst. Because when the World Health Organization came around, I remember everybody was waiting. Will it go from people to people? Is there human transmission? So they were watching for that human transmission. And then once it happened, they said, oh my goodness, it actually happened. And then they told us that it was just droplets. In other words, people have to be sneezing and coughing, and it's not by breathing or anything like that. So then we sort of were a little bit lax about that. But now we're realizing that in close contact, I could breathe the virus and you could breathe it in. So I think one thing that we've learned from this is let's set the bar at the highest. Let's assume that it goes from human to human. Let's assume that it could be breathed out and you can pick it up. So let's defend against that. And then as we find out more about the virus, then we can come downward and release some of those criteria if we find out that it's only droplets and so on and so forth. So I think if we just crank it up to the maximum and assume the worst and then bring it back down, I think in the next virus, we would have a better chance of avoiding some of these horrible things that we're going through right now.
All right, I'll leave it there. Thank you, Dr. Lin. As always, appreciate your time.
Thanks, Vashi.
Medical columnist and family physician, Dr. Peter Lin. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.